Welcome to Nourish MD, Doctor Dietitian Dialogues, where doctors and dietitians empower you about your health and discuss and provide a better path to health and wellness. Proudly presented by Concierge Medical Practice Private Physicians Medical Associates, PPMA, with your hosts, registered dietitians and nutritionist, Lauren Papanos and Romana Brennan.
Hello, everyone, and welcome to Nourish MDs. I'm one of your hosts, Lauren Papanos, and Romana Brennan is joining me here today as well. We have another awesome interview today with Dr. Oliaei, who is from UCI. He has offices both in Placentia as well as Irvine, and he's part of the Department of ENT. And so we are going to be talking to him all about things related to allergies and sinusitis. So thank you so much, Dr. Oliaei, for being here, and welcome to the show.
Yeah, thanks very much for having me.
Yeah, of course. Why don't you just give us a brief introduction to yourself and how you came to kind of be in the position you currently are?
Sure, yeah. So as you mentioned, I'm an ear, nose, and throat specialist and a professor of otolaryngology with UC Irvine currently. I attended the University of Washington and have a bachelor's degree in microbiology. And after that, I completed my medical training at Tulane University. My residency training was here at UC Irvine, and I finished in 2013. I joined Multicare Health Systems in Washington State for about 10 years before I was recruited back to UC Irvine to head the comprehensive otolaryngology program. I have an interest in sinonasal inflammatory disorders, such as sinonasal allergies, the topic today, and infectious inflammatory conditions, as well as minimally invasive treatments of and topical therapies for nasal obstruction and chronic sinusitis.
Well, thank you so much. We're on behalf of both of us, we're just really excited to have you here today. So why don't we jump right into more of the airborne environmental allergy conversation? So from more of this biological standpoint, can you share with us and describe really what's happening in the body that creates the typical environmental allergy response?
Yeah, so allergies are essentially the body's defense against or an overreaction of the body's defense against benign environmental substances. In the case of airborne allergens, there are various white blood cells, such as mast cells or certain types of lymphocytes that are activated immediately upon entry of allergens into the nasal passages. These immune cells then release certain types of chemicals, such as histamines or cytokines, that cause typical nasal allergy symptoms like sneezing, itching, runny nose, and congestion.
Yeah. And myself, as someone who is a pretty strong sufferer of environmental kind of springtime allergies, what makes someone more or less susceptible to having a stronger allergic response?
I mean, to some extent, you can blame your parents. So yeah, certainly genetics have a lot to do with it. And the genetic makeup specifically of your immune cells and those lining cells inside your airways, like inside your nose, for instance. The families that have the genetic makeup and that have the highest prevalence of allergies, they're called atopic families. Children that are born into these families have about a 1 in 2 chance, 50% chance of developing allergies, whereas children that are not born into atopic families have a 1 in 5 chance, or 20%. So genetics are really important, but they're obviously not everything. Your environment too, and in particular, your early childhood exposures have a lot to do with it.
That's so fascinating. I think anything that involves a genetic component is so interesting in terms of how can we modulate, what are some of those things that we can do to help mitigate that effect if, to a certain extent we might be more susceptible, but then kind of that epigenetic piece of things, like what are we doing in order to, mold and shift and influence that environment. So on that same note, what strategies do you recommend to some of your patients who experience those allergies? Maybe they are more genetically susceptible.
Right. So if you have allergies, I mean, it's pretty basic. It's a 3-pronged approach currently, and it involves first and foremost avoidance. For instance, if somebody has dust mite allergies, they want to use dust mite covers for their bedding, for mattresses and pillows. The second prong of the approach is pharmaceuticals, pharmacotherapy, and that involves things like antihistamines, nasal steroids. And the third part of the approach is immunotherapy, identifying what the allergies are and trying to build tolerance within the body.
Wonderful. Yeah. And I know that immunotherapy is used quite a bit for this building that tolerance, like you mentioned. And generally that follows someone who has done allergy testing, right, to understand what are their allergens, both environmental, food allergens, all the above. And so could you just tell us a little bit of an introduction into what someone can expect when they're doing allergy testing and who might be a good candidate for, for completion of allergy testing?
Yeah, I mean, really anybody that has some degree of symptoms can get allergy testing, and it can be useful in any context. But specifically, the patients that I strongly recommend it to are those that have failed the first two parts of the approach to allergies. So they're trying to identify and avoiding their allergens, and the basic pharmaceuticals like, the antihistamines, the Allegras and the Claritins and the Zyrtex and so forth, they're not effective enough for them. So we have to find more approaches, and then really tailor the treatment for them. And for those patients, there are a couple of different testing options. The first one is skin testing, which is where you have the skin pricks on the skin and you have different amounts of reactivity to the different types of allergens, the dust mites and the molds and this pollen and so forth. And then by the degree of reaction on the skin, you give them a score, and then you determine how allergic they are and what they're allergic to. The advantage of that type of testing is that you get instant results, and it can be a little bit more sensitive than the second testing method, which is blood testing for IgE or RAS testing. So that type of testing is usually a single blood draw, and it looks for expression of specific antigens against the things that you're reacting to, the things that you're allergic to. The disadvantage of that is that it can take 1 or 2 weeks to get results for that type of test, because it has to be worked out of the laboratory, sometimes an outside laboratory. And it can be a little bit less sensitive than skin testing. However, there are some advantages. First of all, it's usually a little bit easier, just one blood draw. So as far as just comfort level for patients, it's a little more comfortable generally. And it can also be done in certain patients that you can't do skin testing for. The results aren't reliable because they have certain skin conditions, or because they're on certain medications like antihistamines that can affect the results of skin tests.
I see. Okay, that makes sense. And then you mentioned a little bit about the IgE being what we're testing with the blood testing method. And I know that in practice, we get a lot of patients who maybe have kind of done their own, more so food allergy testing, looking at an IgG response. And I think it's important for us to distinguish between the differences of an IgG response and an IgE response, and what those mean clinically in terms of like severity and treatment. So can you tell us a little bit about what are the distinguishing factors between someone being positive for, say, milk and an IgG test versus someone being positive on an IgE blood test?
Okay, so I'm going to sort of caveat this by saying that I'm not an expert in food allergies, nor do I treat them. So I think this is probably someone that can have a more thorough discussion of that topic with you. But IgG sort of reactions in the body are generally a little bit more delayed, and they're also typically milder than IgE reactions, and they're sort of a bigger topic of discussion when it comes to food allergies compared to the airborne allergies. I'll probably just leave it at that.
Mm-hmm. Okay. And do you ever do IgG testing for environmental allergens?
I do not, but I would defer that to my general allergist colleagues at UCI to be able to tell you whether that's something that they typically do or not.
Sure. Okay. So if someone does the skin prick testing or they get the IgE blood test to identify if they have environmental allergens, they come back positive for some of these environmental allergens. What does that treatment then look like? Because I believe the next step would be immunotherapy or allergy shots, right? Could you tell us a little bit more about how effective those are and any of the other complications that someone could experience if they're undergoing that treatment?
Yeah, certainly. So allergy immunotherapy involves basically receiving small amounts of the things that you're allergic to under the skin over time to try to expose your body to amounts of the allergens that are below the threshold of triggering a response, an allergic response. So if you're allergic to, say, grasses, you get small amount of the grass antigen to the point that your immune system sees it, quote unquote, but doesn't react to it. And over time, we build up the concentration of that shot week after week after week, such that the immune system continues to see it, but continues to ignore it. And as it does that, it builds there's a phenomenon known as tolerance within the immune system, such that it's able to tolerate more and more of that to the point that, even large amounts of that particular allergen, that you're exposed to environmentally will not trigger an allergic response. And that's a really neat phenomenon. We see improvements in terms of patients' symptoms anywhere between 6 to 12 months after initiating allergy immunotherapy. But the process is rigorous and it requires weekly allergy shots or in the case of sublingual immunotherapy, allergy drops over a 2-3, I would say probably 3 to 5 year time period. So the side effects can obviously be if your body does react to the allergy shot or the sublingual drop, you can develop something akin to your typical allergy response or something even more severe than that in the case of anaphylaxis.
And I know that a lot of this natural immunotherapy, I suppose, or natural immune building process happens during childhood. So is there a certain age as to which someone's not going to be responsive to this treatment because maybe their immune system is fully developed and it won't be helpful?
So the question is there a certain age at which it doesn't help
Correct.
someone to receive immunotherapy? No. We do immunotherapy for adults. The immune system is very malleable, even after maturity. So it is that, yeah. So adults can get immunotherapy just like children can.
Discover the wellness you deserve. At Private Physicians Medical Associates, PPMA, you'll receive personalized premium preventive care and one-on-one medical attention with an emphasis on prevention, nutrition, and wellness. Extended office visits, appointment availability, 24/7 physician access, limited patient enrollment, PPO insurance and Medicare accepted. This is concierge medicine. This is medicine the way it should be. Call today for a free consultation at 949-566-8179.
At what point in time, kind of switching the conversation over to more of sinusitis? So we've touched a lot on allergies and allergy testing and things of that sort, but at what point in time does someone need to start asking the question of maybe this isn't seasonal allergies, maybe I'm dealing with something else? How can a patient determine if they do need to seek consultation for something along the lines of sinusitis, or what are some signs that they can help to say, oh yeah, maybe this is not just allergies?
Yeah, I mean, three big things really. If you have sustained face or forehead pressure or pain, and if you have changes in your sense of smell, or if the discharge from your nose is discolored as opposed to clear, you may be suffering from sinusitis. And a consultation with an ear, nose, and throat specialist can help you make that determination.
Gotcha. And is there a clear link between allergies and sinusitis? For example, those individuals who might have more of that genetic predisposition to more of the environmental allergies, do you see those individuals suffer more with sinusitis? Like, are they interconnected in terms of predisposing you for something to develop more into something more serious like sinusitis?
Yeah, I really believe that. So allergies can lead to inflammation of the mucosa, which is the lining of the sinuses. And that inflammation can adversely affect the body's ability to fight bacterial infections. You will have more trouble clearing mucus, and your immune cells do not function normally in an inflamed environment. So your mucus essentially becomes like a broth for bacteria to grow in, unchecked. And so you can kind of think of allergies, at least within the sinonasal tract, which is an area that I'm interested in, as a sort of localized immune suppression. So yes, we do see patients with allergies suffer in many cases from more frequent or more severe and protracted types of sinus infections.
And I know oftentimes, unfortunately, if someone has sinusitis, they might notice chronic sinus infections. So can you just walk through some reasons why someone might develop these recurring infections and how this might turn into more of a chronic sinusitis situation?
So that's a really good question. So what causes something to become protracted? What makes sinusitis last, weeks and weeks and months? There are usually several underlying issues in cases like that. The first one is structural issues within the sinuses that impede drainage and promote inflammation and infection. An example of that is nasal polyps or narrowed openings or inlets to the sinuses, as well as a deviated septum or other structural causes. A second potential issue with patients that get chronic sinusitis, we already talked about, is things like allergies or environmental irritants like cigarette smoke that cause sustained inflammation, and they can weaken your immune system. A third possibility is somebody that's been undertreated or inappropriately treated during an acute infection bout. And then finally, if you have generalized immune suppression, such as with autoimmune disorders, diabetes, or medications that cause immune suppression, you're going to be at a greater risk for developing more severe and chronic types of sinusitis.
Yeah, thank you for explaining that. And just to touch on one thing that you mentioned, this idea of the inappropriate treatment. Would an example of that be taking antibiotics if it's more so like a viral sinusitis?
Yeah, I mean, for that's really important. The example you used. So we do see sometimes patients get antibiotics too early in the course, like they have 2 days of symptoms and they get antibiotics, and then so the bacteria aren't really involved in that infection, but they get to see that antibiotic and they get to develop means of resistance to it. So in the future, you can develop sort of resistant bacterial infections and not be able to treat it with the same antibiotics. So that's absolutely an important one. But there's also sometimes when the length of the antibiotic or the choice of the antibiotic for an actual bacterial infection is inappropriate. It's not long enough, or it's just not the right one. It doesn't treat. I see a lot of times that in my practice, patients come in and they've taken a certain antibiotic that's usually a little easier to take, has fewer side effects, but unfortunately, it doesn't really treat any of the bacteria that typically cause sinus infections. Mm-hmm. And they're like, but I didn't get better. And I have to tell them, unfortunately, you weren't on the right antibiotic. So that's really important. The choice makes a difference.
That's so interesting. Wow. Are there any co-infections or other conditions that you see among your patients with chronic sinusitis that might increase someone's risk of developing chronic sinusitis, or that you suspect maybe develop after the sinusitis, like any co-infections, coexisting conditions?
Okay. I'll give you an example and you tell me if that's what you're thinking or not. I'm not sure if I'm answering the right question, but a lot of times viruses and bacteria work together to cause problems within the sinuses. Many times you see somebody that has, say, a cold, early symptoms of a cold for 3 to 7 days. They don't have too much sinus symptoms, except, they have the runny nose and the typical cold symptoms, upper respiratory infection symptoms. And then all of a sudden, there's symptoms that seem like they were on the mend. They take a turn for worse. They start to develop severe head pressure. The discharge starts to take a turn for being discolored and more copious, larger amounts. And that's when we kind of know what's happened is that this patient went from having a viral infection to a bacterial, what we call super infection. The bacteria took advantage of the inflamed, weakened situation within the nasal passages and the sinuses to cause a bacterial sinus infection.
So something that commonly is used by patients at home, maybe when they start having some of these symptoms, is something like nasal irrigation, such as a Neti pot, Navage, something of that sort. How do you feel about those being used maybe more preventatively before someone comes in to see you for something like antibiotic treatment?
Oh, yeah, I love it. I'm very pro saline irrigations. I think it makes a big difference, both from a preventative standpoint as well as a therapeutic standpoint. And what I mean by that is, we were talking about allergies earlier. I think allergy patients, especially during their particular seasons when they have a lot of symptoms, saline irrigations are super helpful for them because they help to thin out the mucus, remove the mucus, and remove allergens and other air pollutants with it. And they help to reduce inflammation within sinuses. So it does have a preventative effect. It does improve their symptoms. For some of my patients that have severe chronic sinusitis, and for instance, those that undergo surgery post-operatively, we use those same type of saline irrigation, but now they're actually getting into their the inside of the sinuses, and we add topical therapies to them, such as steroids or antibiotics, and that helps to treat their severe inflammation without causing the same degree of side effects as, say, oral steroids or oral antibiotics. So I love saline irrigations.
Great. Okay. And for some patients that do saline irrigation and they get extremely congested after they do it for multiple days, what's going on there? Is it safe for someone to continue with those if it is causing a lot of congestion?
Okay. So couple of notes about that. First of all, obviously, if you do any kind of over-the-counter treatment that's having an adverse effect, you want to stop that treatment and consult your physician, ideally an ear, nose, and throat physician. Secondly, there are some cases where people, the mix isn't completely right. So people can use too little or too much salt. Don't use the packets. They use salt at home, that sort of thing. And that can make a difference. For instance, if you underuse the salt, the water in your saline solution can go into the nasal tissues. It's just an ionic process by osmosis, and that actually makes your nose more congested. So, you have to go back and make sure you're following the directions given by manufacturers or whoever's making the device, or go online and do a lot of research. But it's always better to follow the actual label instructions. Sure. And then the second thing that I do want to mention always about saline irrigations is that you want to make sure you're using either distilled water or boiled water. And of course, let it cool. Don't use the boiled water when it's hot, but one of those two. And the reason for it is there are some rare cases of amoeba infections with people that use tap water for their saline irrigation. It's obviously not something that's common or happens all the time, but it's always best to take precautions.
Sure. Okay. And then if someone is using the correct salt to water ratio, they're still having congestion, then possibly follow up with an ENT because maybe there's something structural or something more serious going on.
Absolutely. Absolutely. If that's the case, if your nasal passages are so tight that you're having a tough time getting the saline in there, sometimes the saline gets into, say, one of the sinuses, these maxillary sinuses in the cheek, and then it's kind of like a irreversible valve type of situation. The saline can't get out, and then you start to have issues with that. Again, it goes back to using correct technique and maybe correcting the underlying problem that's potentially severe. So you really do want to consult someone.
Sure. Okay. Awesome. Well, thank you for sharing all this information with us. It's been super helpful and insightful to all of your specialties, and for someone, because I think this conversation, there's a lot of people that are struggling that maybe don't think it's something serious enough to consult with an ENT over. So I really hope that this episode provides someone with a little bit more clarity as to when might be the right time to ask your PCP for a referral or to, call the office and set up an appointment. So for anyone that is listening that would be interested in setting up an appointment with you, could you tell us a little bit more about how they could go about doing so, or where they could learn more about where you practice?
Sure, absolutely. So as I mentioned, or I don't know if I mentioned it, but my practice is with UC Irvine. My offices are at Irvine and Placentia in Orange County, California. And if you want more information, you can go to ent.uci.edu or search for me or UCI Head and Neck on YouTube and Instagram, where we have a bunch of informational videos about various ear, nose, and throat disorders. And in addition, I want to sort of plug my colleagues with UCI Allergy, where they do a lot of testing and immunotherapy. So you can visit UCI Allergy website for more information about that.
Wonderful. And for anyone that is listening that is a PPMA patient of Dr. Weiss, Dr. Van Meter, or Dr. Davis, go ahead and give the office a call, and we would be happy to set you up for a referral over to Dr. Oliaei. So thank you so much, Dr. Oliaei, for being here. We really appreciate everything you've shared with us today, and we will hopefully talk with you soon.
Sounds good. Thank you very much, guys.
Thank you.
Thank you for joining us for today's episode of Nourish MD, Doctor Dietitian Dialogues. This podcast is intended for general educational purposes only. It is not a substitute for professional medical advice. Please consult with your healthcare provider before beginning any nutrition or supplement recommendations. Sign up for our mailing list so you'll never miss an episode of our wellness journey. See the podcast description for the link.